Hello everyone and welcome. In this lesson we are going to talk about the medical record reports. Medical record reports. Learning outcomes and learning objectives. Learning objectives. By the end of this lesson, learners will have completed parts of medical report, talking personal information and medical history, activities about signs and symptoms and medical complaint. Learning outcomes. Identify medical terminology within medical record reports. Let's get started. Starter activity. What is included on a medical report? Think. What are medical record reports? A medical record report is used by healthcare professionals. It keeps track of a patient's treatment and progress during the time that the patient is in their care. Example: if a patient visits a hospital with medical complaint, there will be a medical record created of their time in the hospital and any follow-up visits. The report will include details such as personal information or demographic information, medical history, medical complaint, physical examination results, test results and diagnosis, a treatment plan and the progress report. Medical record reports. It's important to collect and record information on medical reports correctly. Medical terminology can be used in the report so that the patient condition and treatment will be easily understood by the healthcare professional looking after them. The information in a medical report is confidential. Confidential meaning private or secret, okay, and should only be shared between the patient and the healthcare providers. Now, let's look at the information you will need. Personal information, medical history, medical complaint, physical examination, result, treatment plan and progress. Next, we are going to talk about personal information. Personal information, the first part of a medical record report, contains the patient's personal information. Name, Ahmad. Date of birth, gender, male, ethnicity, where the patient is from, Egypt, now UAE, their religion is Muslim, and the language they speak Arabic and English. Contact information, the patient address, phone number and email address. Address, the patient address and phone number 050-125-0689, email address at gmail.com. Medical history. The patient's medical history should be included in the report. The question in the section can include medical condition, medication allergies. Medical condition, any medical condition that the patient has, or any condition that they have had in the past. This can help to what? Help to diagnose and treat their current medical issue. Medication, any medication that the patient takes. This is important. Why? Because some medication should not be taken within other. This is important because some medication shouldn't be taken with other. Allergies, any allergies that the patient has. The patient could be allergic to certain medication, which could cause them harm. Medical condition, medication, allergies الحساسية. Medical complaint. The medical complaint section of the medical report is the reason why the patient is visiting the hospital or surgery. Any sign and symptoms of their illness should be written in this section. What is signs? What is symptoms? What is the difference between sign and symptoms? Signs, evidence of an illness that can be seen by other, such as a skin rash or cough, الكحة أو skin rash اللي هو الطفح الجلدي. Symptoms, a feeling or physical change experienced by a patient, such as pain or tiredness. Physical examination. Examination meaning a close and careful study of someone to find sign of illness or injury. Physical examination. The health professional will carry out physical examination of the patient. The examination will show if the patient has any abnormal signs. A physical examination includes the following checks. Important: height and weight, الطول والوزن. Vital static, which include blood pressure. Blood pressure means the pressure of blood in the circulatory system. Pulse rate, the number of times that heart beats each minute. Respiration, meaning the rate of breathing. Temperature, how warm or cold the body is. Physical examination. Examination meaning a close and careful study of someone to find signs of illness or injury. Physical examination. The health professional will carry out physical examination of the patient. The examination will show if the patient has any abnormal signs. A physical examination includes the following checks: height and weight, الطول والوزن. Vital static like blood pressure اللي هو meaning the pressure of blood in the circulatory system اللي هو ضغط الدم. blood pressure in the circulatory system في الجهاز الدوري. plus rate اللي هو نبض القلب. the number اللي هو عدد دقاته في الدقيقة مثلا. the number of time that heart beats each minute. respiration meaning التنفس. the rate of breathing. temperature, how warm or cold the body is. Number 3, examination of body and body system including head and neck, الرأس والرقبة. chest اللي هو الصدر. heart, قلب and lungs اللي هو الرئتين. skin and extremities, arms and legs. stomach and the body's movement. What does diagnose mean? Diagnose mean the act of identifying a disease, an illness, or problem by examining someone. Test result and diagnose. This part of the medical report will be used to. بتستخدم لإيه؟ record the results of the physical examination and the result of any other test that the patient has had. The patient might have different tests اللي هي الاختبارات المختلفة to confirm the presence of an illness or disease. This could include blood tests and X-rays or other diagnostic assessment. Medical terminology will be used to describe the different tests that have been taken and their results. Example: Dr. Al-Qasmi is examining a 56 years old patient. The patient says they have been feeling very tired recently and have had some chest pain. The patient is overweight and has unhealthy diet. During the physical exam, the patient's blood pressure and heart rate measurement are both high. Dr. Al-Qasmi recommended that the patient has a blood test and X-ray to help find the medical problem. The test results are recorded in the test result part of the medical record reports. For example, test result: the physical examination results show توضح أو تبين that the patient is overweight. They have mild hypertension and mild tachycardia. The X-ray results show no abnormalities in the chest area. The blood test results show that the patient has hyperglycemia, so much sugar in the blood. All other tests were normal. Based on the test results, Dr. Al-Qasmi can diagnose what is wrong with the patient and make a treatment plan. Next, we are going to talk about treatment plan and progress. After the disease or illness has been diagnosed, the healthcare professional will write a treatment plan on this part of the report. Treatment plan: this section will record what treatment the patient will receive. It can include any medication they must take, any surgery they need to have, recommending lifestyle changes. Progress: when the patient visits the healthcare provider for follow-up appointment, their progress is recorded to make sure the treatment plan is working. Clear? Further information: Unified Medical Record in the United Arab Emirates. The Ministry of Health and Prevention in the UAE is creating a database that will digitally store all individual patient medical record in one place. By 2022, public and private hospitals across the country will share medical record for the first time to improve the quality of service and patient care. The unified database will link the complete medical data of all patients. This will give all doctors access to all the patient health information from hospital visit to diagnostic tests from any healthcare center. Medical record reports: personal information, name Fatima Ibrahim, date of birth gender female, ethnicity United Arab Emirates, medical condition high blood pressure or meaning hypertension, medication blood pressure medication, allergies no allergies, medical complaint sign and symptoms: she feel weak and tired and has chest pain. Physical examination: vital static like height, weight, blood pressure, pulse rate and respiration and temperature. Clear? part of exam. Question 1. Which of the following best describe a symptoms of disease? A feeling or physical change experienced by patient such as pain or tiredness, evidence of an illness that can be seen by others such as skin rash or cough, something that stops the disease and makes someone healthy again. Which of the following best describe a symptoms? احنا اخدنا الفرق بين الساين واخدنا السيمتومز. الساين قلت لك تشوفه can be seen. السيمتومز feel. Which of the following best describe a symptoms of disease? Your answer is a feeling or physical change experienced by patients such as pain or tiredness, ولا evidence of an illness that can be seen by others such as skin rash or cough, something that stop the disease and make someone and one health again. إجابتك أشوفها في التعليقات في الكومنت. Question 2. There are different signs and symptoms of each disease. Identify which of the following is a sign of disease. Feeling tired, pain in back, coughing, difficulty concentrating. Sign can be seen. Symptoms feel. There are different signs and symptoms of each disease. ركز في السؤال. Identify which of the following is sign of disease. sign seen. feeling tired طبعا برا. pain in back ألم في الظهر، ولا coughing اللي هو الكحة، ولا difficulty concentrating. Your answer is انتظر إجابتك في الكومنت وهرد على كل سؤال. Question 3. Choose two facts that need to go in medical report. Two facts. اختار حقيقتين that needs to go in medical report تحتاجها في التقرير الطبي. eye color ولا medical history ولا allergies ولا how many brother you have. medical history, allergies. Question 4. It shows to reason why it's important for a doctor to ask about medical history. It's important to know about your allergies, ولا it can help them diagnose your medical problem, ولا the doctor can tell everyone about your medical history, ولا you can become friends with the doctor. Choose to reason. اختار سببين why it's important for a doctor to ask about medical history. ليه الطبيب بيسأل المريض مثلا عن التاريخ الطبي له؟ عشان مثلا you can become friends with the doctor عشان يصاحبه، ولا the doctor can tell everyone about your medical history، ولا الدكتور هيعرف او هيخبر كل اللي موجود معاه في الميديكال your medical history، ولا it's important to know about your allergies عشان يعرف ايه هو، هل هو عنده حساسية ولا لأ، ولا it can help them diagnose your medical problem علشان يساعده في التشخيص. diagnose يعني يشخص your medical problem المشكلة الطبية لديه. تختار سببين. your answer is. انتظرها في التعليقات وهرد على كل إجابة إن شاء الله. question 5. what does the ethnicity mean? ethnicity meaning nationality or date of birth or phone number or male or and female. ethnicity mean nationality. thank you all of you. and goodbye.